Hi everyone, it's Dr. Rihani. Today we are coming from the operating room to discuss local anesthesia versus general versus IV sedation for facelifting procedures. The real reason that we are using general anesthesia instead of IV sedation is actually for airway security. And if you've ever fallen asleep and caught yourself snoring, you know that as you are drowsy, your tongue base actually can fall back into your airway. If you combine that with the fact that we're operating in the neck itself and there can be swelling and bleeding, it could pose a significant risk in terms of compromising your airway. And so by actually placing a breathing tube, we know that the airway is secure, that the anesthesia team can really closely monitor your breathing during the entirety of the surgery, no matter what we're doing. These procedures do require anesthesia even under IV sedation. It's just a different type of anesthesia. The total amount of anesthesia given for an IV sedation case is very similar to the amount of anesthesia given during a general anesthesia case. I find that IV sedation is, it's really almost like a selling point, and I don't actually think that it's better for patients. I think that the airway is the most important concern that we have when performing a face and neck lift. So what's the downside of general anesthesia? We do know that there is a slightly increased risk of forming blood clots under general anesthesia. Generally, that's something that can happen after surgery when patients are not able to mobilize very well. In patients that have had facial surgery, though, they're up, they're walking the same day, they're up walking the next day. And so the risk of blood clots in a patient that has never had a blood clot is actually very low. So I find that this is a bad argument for using IV sedation compared to general. Everybody thinks that local anesthesia sounds great and IV sedation sounds great, but in reality, these procedures are fairly long, and a lot of our procedures are anywhere from 4 to 6 hours. So that's a long time to be laying on your back going through a procedure. Well, thanks for listening about local versus IV sedation versus general anesthesia. If you have any questions, please let us know. We'll see you next time. Thanks.